Great. So thank you so much to Arun, who actually gave an example of a systematic review. So this is perfect and leads right into my next portion of the presentation. So thank you so much. So a systematic review, as the Cochrane collaboration definition notes, is that it uses systematic and explicit methods to identify, select, critically appraise, and extract and analyze data from relevant research. So Arun mentioned, you know, with his systematic review that the team did, this was actually a health systems question, and walked us through some of the methods that they used to make sure that, you know, the results that they had were quite robust. So as everyone is aware, the Cochrane collaboration is known for the most methodologically, for producing the most methodologically robust systematic reviews internationally. And an extension of systematic review is a meta-analysis. So again, in Arun's presentation, he discussed how they did a meta-analysis. So this is a statistical technique that can be used to pool the results from more than one study. And as mentioned at the beginning of my presentation, since we have many patients and many studies being combined, we actually have a bit more confidence in our results than if it was just from one individual study. So thank you to Arun and his team for his example. This is another example of one that we had conducted. So this was for our Canadian Institutes of Health Research Drug Safety and Effectiveness Network. So we were looking at the efficacy and safety of cognitive enhancers for mild cognitive impairment. So systematic review really lends itself nicely when we're looking at effectiveness questions or efficacy questions as well as safety questions. So we can do a systematic review and meta-analysis and let our policymakers know that in this case, mild cognitive, these cognitive enhancer medications were actually not effective for mild cognitive impairment and actually led to some harms. So they found that it led to more patients experiencing nausea, diarrhea, vomiting, and headaches. So this influenced the decision to not list these agents. So the government was thinking about potentially allowing some patients to use these medications, but they decided, no, let's not allow this because there's just no evidence and it's causing harm. It also informed the national guidelines on dementia, and it was also used in our Royal College of Physicians and Surgeons examination. And we did have a press release with mass media articles. So this shows how we can do a type of knowledge synthesis. In this example was a systematic review for knowledge users. In this case, it was the government, and how we can have an impact on the healthcare of a country, and in this case, it's Canadians. So now I'll move on to a network meta-analysis. And again, we'll focus on the Cochrane collaboration, who are leaders in advancing network meta-analysis. And so this is an extension of indirect comparisons, and it allows us to combine direct evidence from head-to-head studies with indirect comparisons. And we can also analyze many different comparative effects of multiple interventions at one time. So when we do our meta-analysis, pairwise meta-analysis, we can only compare two things at a time. But when we do a network meta-analysis, we can actually compare multiple things simultaneously. So let's say we have a trial where we have patients who are randomized to intervention A and intervention B. Well, we can then do a meta-analysis of 4 trials for intervention A versus B. Again, this is our traditional pairwise meta-analysis. But we can extend this to a network meta-analysis where we have multiple trials and interventions. And if you see here with the red circle, we can actually statistically compare studies indirectly that have never been compared in a head-to-head study. So it's quite powerful to do a network meta-analysis. So we follow all of the same systematic review methods, but then it's actually a larger review in the end because we have all the interventions for a particular health condition. And the really cool thing about it is that we can also rank. So we could say for this outcome, this intervention is the most effective, and rank all the different interventions that we're comparing. So this is an example of a systematic review and network meta-analysis that we did for long-acting versus intermediate-acting insulin for patients with type 1 diabetes. And this was actually done for our knowledge users from the British Columbia Ministry of Health. And this influenced the decision. So they were listing the agents in British Columbia in a certain way, and our results actually supported the way that they were listing it. And again, we had a press release, and it was used last year to update the WHO list of essential medicines. So again, now I'm showing how we can do a type of knowledge synthesis, which was a network meta-analysis, and we can help decision makers, in this case, the Ministry of Health, as well as the World Health Organization. And we're now extending this project for the WHO, as well as decision makers in Canada. And we're including additional agents, and we're doing some further analysis. So the results hopefully will be out in the next year or so. So now I'm going to move on to some other types of knowledge synthesis, and I'm not going to spend so much time because you know, we could probably spend a whole week talking about all the different types and the methods and that type of thing. But I really want us to start today. I really want us to focus on thinking about how a knowledge user comes to us, and then how do we select the most appropriate method that can help them with their decision-making needs. So another type of review is a scoping review. So this is an exploratory project where we want to map all the literature given on a topic. So we want to think about the key concepts, theories, sources of evidence, and gaps. An example of one that we did was care coordination quality improvement interventions to support primary healthcare providers who were frequent users of the healthcare system. And so this was one that we had done for, again, our Ontario Ministry of Health. Another type of review is an overview of reviews. And again, Cochrane is a leader in this type of review, and there is a review group that does a lot of methods in this area. So an overview of reviews, well, we use this when there are multiple reviews for a single condition or health problem. So when we have 2 or more potential interventions, and we know that there are many reviews, then oftentimes we'll suggest to our knowledge user that, you know what, let's do an overview of reviews. So this is quite helpful, and it also helps us to make sure that we provide them results in a timely way, because we don't have to go through all of the individual studies, but we can focus on actually the reviews. So an example that our team conducted was, what are effective interventions for treating complex wounds? And because there's so much evidence out there on treating wounds, and there's so many different reviews, and they were interested in many different interventions, we decided to do an overview of reviews. And this was actually for our local health integrated network. So this was a very local example of a local knowledge user. So where we did a knowledge synthesis for a local knowledge user. Another type of review is a rapid review, and so this is when we actually use methodological, we take some shortcuts, or we simplify our process. So we actually have to tailor our methods according to what our knowledge users require, right? So one that we did was the comparative safety and effectiveness of inhaled corticosteroids and beta agonists for chronic asthma. And in this case, the knowledge users were particularly interested in us to do a rapid update of a previously published systematic review. So there was a systematic review, I believe it was published in JAMA, and what we did is we updated it really quickly, and we did this rapid review for them within 3 months. So that's an example of where we did a knowledge synthesis rapidly, and this was for, again, our Ontario Ministry of Health. So diagnostic review, this is a type of review where we want to know how well a diagnostic test works. So an example that we did was for, does this patient have exudative pleural effusion? So this was a question where we needed to let our clinician partners, so this would be our knowledge users, in this case would be clinicians, and they were working in this area. And they needed to know whether this particular test actually works for patients. So again, Cochrane is a leader in diagnostic reviews, and they do have a review group that specializes in doing reviews of diagnosis. And another type of review that Cochrane is, again, experts in is a prognostic review. And they do have a prognostic group as well. So this is trying to figure out how do we predict a disease outcome or more accurately or efficiently. And this is an example of one that wasn't actually conducted by our group, but the example is, can recovery expectations predict outcomes in non-chronic, non-specific low back pain? So this again was done to help clinicians better predict outcomes for those who had back pain. And lastly here, I have an economic review, and again, the example by Arun was actually trying to get at this as well. So we can use economic reviews to synthesize economic studies, such as cost effectiveness analyses or costing studies. So if we're really interested in cost, we can use an economic review. An example of one that we did was looking at the cost effectiveness of interventions for complex wound care. And again, this was for our local health integrated network. So it was a local unit in Toronto. So just to give you an example of all those different methods, so the one that I wanted to build upon was the one that we did for our Ontario Ministry of Health, and this was their Bridges initiative. And they were particularly interested in these quality improvement strategies for frequent users. So frequent users would be, these patients that keep encountering our healthcare system, and we had defined them as 5 or more times. And they wanted to know, what can we do to help these patients and help manage them a bit better? So we did a scoping review for them. And in terms of impact, it influenced the policy for alternate levels of care for patients by the Ontario Ministry of Health and Long-Term Care. And it actually was used to establish an intervention for a clinical trial. So sometimes we don't know how to do a targeted intervention, and sometimes we want to use a knowledge synthesis to actually help us figure out what kind of an intervention will we do for subsequent research. So this is an example where a knowledge synthesis would be used in that way. And again, we did have a press release for this particular study as well. So now I'm going to move on to these emerging knowledge synthesis methods, and I don't want to spend a ton of time talking about them. We do have leaders in Cochrane, so we have the Cochrane Qualitative and Implementation Group that is leading these emerging knowledge synthesis methods. And they do have a handbook that I believe they're updating right now on how to do these methods. And they are releasing a series of papers in their Journal of Clinical Epidemiology in the next year or so to try to provide more guidance on doing these really exciting methods that I think will be really applicable to healthcare and probably will be really helpful to our knowledge users. So we published a series of papers, so we as in me and my team, last year in the Journal of Clinical Epidemiology, and we actually came up with a conceptual algorithm to try to select which knowledge synthesis method might be helpful for our knowledge users, in particular if we're dealing with complex evidence as we are when we're doing reviews of health systems. So we have an integrative review, and so this allows us to integrate qualitative and quantitative data. And the example here that I have is self-care management interventions led by nurse principal investigators for those with cancer. And if you go to our series of papers in the Journal of Clinical Epidemiology, we see that the integrative review is the most helpful for generating or refining a theory or hypothesis. So that would be, if we wanted to generate or refine a theory, then we would potentially think about doing an integrative review. We also have the metasynthesis. So this is a process where we use logical deduction. An example is, what are the lived experiences of individuals with tic disorders and Tourette's syndrome? So again, when we consult our algorithm, we see that metasynthesis is most helpful to explore experiences, perceptions, preferences, beliefs, and values. It also can be, as we see here, it can be helpful for identifying gaps and the need for future research as well, which many of the methods can help with too. So if we were thinking about patients' experience of disease, we would consider using the metasynthesis. And we also have a mixed study review. So this is when you want to integrate qualitative and quantitative studies, or perhaps you have studies that have mixed methods, so studies that actually do qualitative and quantitative. And you may have actually both. So you have mixed studies, and then you also have qualitative or quantitative. So this is when you want to really think about trying to integrate together qualitative evidence with quantitative evidence. And again, this is particularly helpful for the preferences of patients. So in this case, we have palliative phase of illness. And also, I think that Arun's example kind of has, kind of follows these lines as well, because they did do the meta-analysis, and then they did do some kind of a thematic analysis where they came up with this process flow pathway and a conceptual framework. So this would be really helpful to our knowledge users when, you know, we want to do meta-analysis as well as kind of come up with a conceptual framework. So we have as well a meta-interpretation. So this can help us describe methods that provide a broader understanding of human behavior experience, and it's supposed to help lead to new insights. So an example would be, how can public health agency enhance the public's trust in the food safety regulatory system? So when we think about meta-interpretation, it's really helpful, again, to help explore patients' experiences, perceptions, preferences, beliefs, and values. So we're seeing that, you know, we have many of these kind of methods that can help with this. I'm not going to spend a lot of time with the other two methods on this slide, just in for the sake of time. But we do have all of them in our Journal of Clinical Epidemiology series of papers, and the references are at the end of this presentation. So for this slide, what I would like to focus on is the meta-narrative review, because this one can actually be used to explore methodological aspects of a topic or knowledge synthesis method. So it can be used above and beyond, you know, trying to explore experiences. So some of the methods have different purposes, which you will see in the conceptual framework that we have provided in our series. So on this slide, I wanted to highlight the realist review. So the realist review is particularly helpful to help generate or refine a theory or hypothesis. And it can help us not only determine, it can actually help build off of a systematic review findings. So in our systematic review, we can figure out what works. And then in our realist review, we can actually figure out what works for whom, under what circumstances, and why. So realist reviews are really helpful for our knowledge users when they want to kind of go beyond the systematic review results and figure out, you know, in which context would a particular intervention work. So I wanted to give you a quick example from our team. So we did a systematic review and then a meta-study synthesis of qualitative studies that looked at the facilitators and barriers to participating in colorectal cancer screening. And this was conducted for Cancer Care Ontario. So this would be an example of a provincial knowledge user that we were responding to through this knowledge synthesis. And this actually helped influence cancer screening policies at Cancer Care Ontario. So it helped break down some of the barriers for patients and help figure out how to target specific patients. So now we're going to do a quick activity to make sure that you've all been paying attention and to kind of put your knowledge to practice here. So just quickly, we have a few minutes for this because I want to allow some time for questions at the end. So I want you to read the scenario and then identify the type of review that you would do based on the question. So I'm going to open the poll here, so everyone should be able to poll. So what is known from the existing literature about mental health issues among immigrant and refugee youth in Canada? So if a policymaker came to you and asked you this question, it probably wouldn't be asked in this way, but you would work together to come up with this research question. What type of a review do you think, or what type of a knowledge synthesis do you think would be the most appropriate? So I have just launched this. So we'll give a few minutes here for everyone to vote, or maybe 1 minute for everyone to vote. Great. Well, we have about 50% who have voted. So I think that we can actually close this poll because we see 60% now actually. So the majority have voted and the majority have selected a scoping review. And I would say you're absolutely right. So the way that we know it's a scoping review is that we're asking what is known from the literature, right? So when you want to know what has been done before and scope it all out, then a scoping review is really, really helpful. Excellent. So I am now going to move on to the next slide. So now this one, I'm going to open the next poll, if I can here. So this poll, I'm going to open it. So what are the effects of participating in creative activities on the health and well-being of children's self-confidence, self-esteem, levels of knowledge, and physical activity? So if a knowledge user was asking you, again, it wouldn't be worded this way because sometimes questions come to us in a way that's not really researchable, but we would work together with our knowledge user and come up with this question. And so if they were asking you this, what type of a knowledge synthesis do you think that we would do? So I'll give everyone a couple seconds. Great, so we're almost at 50%. Give a couple more seconds here. Great, so we have more than 60%. So we see here that the majority is saying a systematic review. And that's exactly right. So, and the clue in this one was asking what are the effects. So anytime we're asking about the effects or the safety or the effectiveness, a lot of times here, that's a clue that, you know, maybe a systematic review is helpful. And specifically if your knowledge users want a meta-analysis, then, you know, you would likely want to go with a systematic review. So this is kind of a nice worked example of where we're kind of working together with our hypothetical knowledge users and thinking about what type of a knowledge synthesis would we choose. Excellent. So in summary, today I actually presented 20 different types of knowledge synthesis, and I'm not expecting you to remember all of them, but just to expand your thinking above and beyond systematic reviews, right? Because I think a lot of us, for me anyways, my go-to is a systematic review because it's what I know best, right? But sometimes another type of knowledge synthesis would actually be most helpful or more helpful to our knowledge users. So we're going to use this information today, hopefully in the next few months and are on your journey here, to try to start thinking how we can match a knowledge synthesis posed by our knowledge users to a specific method. So hopefully today we've reached our learning objectives and we've been able to think about or provide maybe a unique perspective, or maybe it's everything you've already known about why knowledge synthesis is important for decision making, the different types of knowledge synthesis, and how we can start selecting a knowledge synthesis method.